Good afternoon. TechNation editor John Wallace here. I am so excited to be with you today as we learn more about the tool of the trade featured in the July issue of TechNation magazine, the Contact IO asset tracking platform. Senior Solutions Architect Tim Young is today's presenter. I want to thank Contact IO for sponsoring this great webinar and tools of the trade demo. Contact IO optimizes processes and resources by revealing how patients move through care delivery. Using AI, IoT, and RTLS, they help healthcare systems uncover waste, streamline capacity, improve workflows, and help staff and patients feel seen and valued. Solving for more than 20 use cases in care operations, they offer a single platform that is easy to deploy and scale with fast time to value. Since 2013, Contact IO has provided solutions to more than 32,000 end users, delivered via 1,200 or more partners, and deployed more than 4 million Internet of Things devices in the field. Before we begin, I want to remind attendees that today's presentation is eligible for 1 CE credit from the ACI. 1 hour after the end of today's broadcast, you will receive an emailed survey. Completing that survey will grant access to a certificate that you can download and print from your desktop. We will wrap up today's broadcast with a question and answer session. Please note that the webinar dashboard includes questions feature. You can submit your questions for our presenters at any time during the demo, and we will present those to the presenter after his prepared webinar. And I'm excited to share that this year we are celebrating Webinar Wednesday's 10th anniversary. As part of that celebration, during today's demo, we will give away a pair of Apple AirPods to an attendee who can answer the following trivia question. This Friday sees the official start of the 2024 Olympic Games. Which city and country is hosting the games? Answer now using the questions feature on your dashboard, and I'll reveal the answer and the winner at the end of the webinar. Also, TechNation magazine is excited to announce that we're accepting nominations for the second annual Tech Choice Awards. Find out how to make a nomination at onetechnation.com. Now, let's learn more about the Contact IO asset tracking platform from Senior Solutions Architect Tim Young. Tim, you may begin whenever you are ready.
Hey, thanks, John. Thanks for the introduction and for the reminder about the Olympics being hosted in blank city and blank country. Excited to see the answers for that. As John said, I'm Tim Young, Senior Solutions Architect for Contact IO. Really excited to be here with you all today. Little housekeeping, just a reminder, in the handouts section, there's some collateral there if you'd like to do additional reading after the webinar or have something up as well during. Feel free to view those and download them at your leisure. Our agenda for today is going to be all things medical equipment. I'm going to start off with kind of just a brief recap of things we've talked about in the past regarding the failures of RTLS. I'll keep it brief, have no fear there. And then I want to kind of get a good understanding of the lay of the land when it comes to our platform and what infrastructure might be required, what cloud deployment looks like. This won't take too long. Then we'll look at the physical tags themselves that we can affix to different types of medical equipment. Talk briefly about common equipment management issues. And then that will kind of be the kickstart into the most exciting piece, which is really just a live demonstration of what our platform is capable of and how you can go from solving very simple tasks to incredibly complex ones, from our simple to advanced tools, and then also what kind of analytics we've got. I have a sneak peek too of some additional capabilities. We'll talk about the ROI aspect of asset tracking, what you need to do from a deployment perspective, i.e. what very little you need to do from a deployment perspective, and then we'll have fun at the end with Q&A. So please drop questions in as you think of them, and we'll wrap those all up at the end. And if we don't have time for all of them, there'll be plenty of time to get those questions back to you this week. So to start off with, RTLS and kind of the failures of it, because many of you probably have either a system now or were involved in and actually used a system in the past. And the question I always ask is, has it delivered as expected? And rarely we'll get an answer that, yeah, absolutely, it's been working as expected. But more commonly, I get a really big response is that even if it did work, we received no ROI. And that was because of the three main issues I've got on screen here, which is the cost was just really high. Infrastructure was expensive. Batteries ended up being an absolute nightmare to maintain. It only solved for one point solution. So while it worked for one department, it didn't really scale to other things that a hospital who has to keep in line with shrinking margins wasn't able to advance towards. Due in part because the hardware itself was not scalable and not flexible. I promised I would be brief. That was it. But that kind of led to the fact that many people just couldn't afford to take advantage of the solutions that are being provided from an asset tracking or a medical equipment management perspective. So only 30% of hospitals were able to even just afford those benefits. So it left many out of being able to streamline and optimize their care delivery process. And what Contact.io is doing with our application is providing a simple, affordable, and accessible way to get all of these great benefits from real-time locating systems. And we do that using existing Wi-Fi and existing BLE and also forms of that we provide as well. From a platform perspective, we propose this single platform approach to transfer all care delivery processes along what we dub the inpatient journey, whether that's the journey of medical devices or staff or patients. All of these things are what I like to call the pillars of a responsive health system. They all have unique workflows that dictate how optimal a facility is being run. So our platform is able to run all of these different use cases in a single location, providing outcomes for you that make your job easier and more efficient. And we do this, I kind of said the simple, affordable, accessible approach by being built on an open standard platform, and that platform being driven primarily by Bluetooth Low Energy. It's an open standard, many different Bluetooth devices. This allows us to do very easy installation, allows us to deploy our Keo apps in record time and great speed, especially when we're putting out updates for them. And then also allows for us this kind of methodology of being open standard to allow us to send information to other systems via our APIs. Let's not hide the data and keep it. Let's make sure that we're sharing it with anybody that needs to know to optimize our workflow more efficiently. The IoT stack, as we call it, is pretty straightforward. I break it up into three buckets here. On the left are all of our room sensors, badges, tags. These are low-cost Bluetooth connectivity devices, which boast a couple things. One, they're a global standard, so they're low cost. It's not something that Contact.io is making themselves. This is something that there's a global market for, which is great because it keeps costs down for everybody. But more important than that is battery life. We mentioned that being a really big impact on the total cost of ownership or the lack of an ROI from previous systems, because a battery for a tag might last 6 months. Great, you have location for all of your IV pumps, and then in 6 months your tag dies. You can't find the device to replace the tag because you weren't expecting it to die so soon, and now you've lost visibility. So the battery life superiority from a BLE perspective is not something to forget about. We're looking at 4 years and beyond for many of our tags. It's quite a bit of an improvement from legacy RTLS providers. All of that information flowing over what we call enterprise BLE connectivity. And that is where we shine from a platform perspective in ensuring that we're utilizing any great investments that IT has made in forward thinking IoT infrastructure, like access points that are BLE enabled, But in situations where we're running some older equipment and it's not BLE enabled, no problem. We have an enterprise overlay that we can bring in that will provide that BLE connectivity, which then pushes all information quickly to our cloud applications. Everything we do is hosted in the cloud. There's no on-site servers, no on-site databases, nothing that needs to be managed from that perspective. And this is where we can enrich the information we're receiving with additional metadata, connect with other systems to provide really nice outcomes for you to do your job. So that's kind of the IoT platform stack. I think key takeaways is BLE, great battery performance, and then from a connectivity perspective, we love utilizing any infrastructure that's already in place if we can. There's no reason to just add devices because we think we need to. Let's use what is there. Let's use what's already been invested in. And then cloud. We're a cloud-first company. Everything's managed on there. Very simple to deploy from that perspective, which you'll see in a little bit what I mean by that. So now that we've talked about the overarching platform, let's talk about the things that actually go on devices. I've got a bunch of them, but I'm only going to show a few today. I have what we call the Asset Tag 2. It's about the size of, well, actually it's about the size of the prize for today, an AirPod case. And we use this predominantly, it's a little larger, use it predominantly on wheelchairs, beds, transport related items. It's a little large, but it also has 2 programmable buttons on it, which we'll get into a little bit later, but it allows you to automate a few workflows or trigger some really fast workflows to say, okay, I'll just tell you now. When this bed is broken, hey, just press the red button. We'll automatically open a ticket that says this bariatric bed is down, it needs service, and it's located here. And you'll also receive that updated location if it happens to move. So now you've got a ticket open for it. You're not going to stumble over it later realizing, hey, why didn't anybody tell me about this? The next and kind of our most utilized device is the Asset Tag 2 Mini, aptly named. Much smaller than the first one I'm showing, and this goes on really everything. IV pumps predominantly, wows, telepacks, wound vacs, kind of just pick out a device at random, and this will be the one that we've been affixing to it. Really great battery life. Does also have a programmable button, just one, so we can't do a whole lot of different things with it if we're trying to get a little crazy, but I'll talk about how we can automate workflows without having to even press buttons, which is very exciting once we get into the live demo. Both of these can be affixed with a adhesive. It's a very strong adhesive. We'll call it like a little peel and stick deployment. But also this gentleman has a pass-through for a zip tie. So when we're trying to affix it to large, maybe round items, that's how we can do that. A really exciting device that or a tag that we launched, this isn't it, this is a phone, is the sticker tag. And the sticker tag was developed to solve the tracking of IT equipment, really, but for iPads, things that you couldn't traditionally put a massive tag on because nobody's going to want to carry this around. It's clunky, it's awkward. This is a very tiny device, but would usually be tracked with Wi-Fi. But that only works if the device is on. And once the iPhone dies, and if you've got an iPhone, you'll know it doesn't really last as long as you would expect. So then you've lost visibility. And these are devices that are typically shared throughout a department. And the reason I keep flashing this in front of your screen for you is that if I take the case off, you'll see underneath I have the Contact IO sticker tag. So it's paper thin. It actually weighs less than a piece of paper, independently verified by myself because I did not believe marketing when they told me that, but I weighed it and it does weigh that. Very thin, Bluetooth, low energy. This has been fantastic for solving those issues around very thin equipment that IT's been having struggles with for a very long time. So something I'm very excited about to show you guys. So those are just a few of the physical devices that will mount on different tags, or sorry, different assets. Let's cover briefly the issues, and then we'll jump into the meat of this webinar, which is the live demonstration. IV pumps we talk about a lot because, well, for one, they're very expensive, and you've got a lot of them typically. And what we're seeing across the US right now is that 65% of IV pump fleets are not being utilized. They are sitting unneeded in a closet that somebody hoarded at one time and then forgot they were there. And this is almost $500,000 in CapEx just wasted by things sitting around and not doing anything, not being used. So 30 to 40%, I think, is our average for things that are actually utilized. Another major consideration for medical equipment, which I'm sure you're aware of, even as far as the nurse we have on screen here, which is just man hours spent manually searching. Folks from every department has spent unneeded time wandering facilities and just looking for things. So that's from a productivity perspective, time could be better spent elsewhere if we can unlock that for you. And then loss, shrinkage. An average 200-bed hospital on average loses 4% of just their telemetry devices annually, which is about $150,000 of wasted equipment every single year. And then another thing IV pump related is rental costs or just rentals in general for IV pumps. Costs a lot to rent them. There's also a nice little late fee if you cannot find it or forget to return it. So having the visibility of where those are to be able to not only return them on time, but reduce the rental usage is really beneficial. Aha! We've gotten through me just talking about things, and now we can get to the live demo. So, as I said, we are a cloud-first application, and what this means is any device, whether it's a laptop, a tablet, a phone, log into your specific tenant URL, and you'll have access to our what we call the KIO apps, Contact.io applications. And beneficial in a couple reasons, the cloud first perspective. Well, one of my favorite things is that it's what we call an evergreen product, which means it's always fresh, always with the latest and greatest. There's no downtime required to push out an update that you require, that you ask for. Hey, I'd like this little column, or can we get a cute little icon over here for this? It's very easy to make changes and deploy them to you with zero interruption, zero downtime. So how do we get from we have nothing to a functioning asset management solution? And I want to walk through how we do a little bit of setup, because I think it's important to understand our methodology and philosophy on how to carve up indoor buildings into a usable space. And what I mean by that is we'll use an app that we call Smart Location. This is something our professional services team will do. But we'll take your floor plan, beautify it so it looks nice, so we're not just looking at some ugly CAD drawing with a bunch of sinks and toilets all over the place, and give it names. Because when I'm providing you a list of locations, it's not very useful for me to say medical center, General Memorial Hospital, first floor, X24, Y13. I mean, that's unless you're really good with your X and Y of your building, you might not know where that is. And we are about rooms. We believe carving your facilities into human-centric nomenclature allows it to be easier to be understood and easier to use and easier to move through. So we'll label everything. So I got SICU 11, 10, 9, the nurse station, certain corridors, elevator lobbies, anything you can name, we're going to list it out and show a specific room name. We'll also be able to organize them by departments. And what we do from there is then how we start to automate some things. So from there, I like to assign all of these different rooms, room types. And this is very critical because once my team has identified these types of rooms are a clean storage, and these types of rooms are a clean utility, and this is a common room, a corridor, I'm just reading down the list here, an exam room. We can then use that location of a IV pump with an asset tag too many has moved into the clean storage without any intervention by you or your colleagues. We can now automatically change its status to clean. You don't need to press a button. We know it's there, and that type of automation is really beneficial, but also I'm capturing that historically. So over time, we can see how things are moving throughout. So we'll create all these room types and we'll match rooms to certain room types. Really beneficial. We love rooms. We love room types. That is how we I'll keep saying it, carve up your indoor space. So if I go back to the launch pad, I got a bunch of applications here, and I'm gonna start with Asset Tracker because it's really our basic one. And I'm gonna go through 3 of them today with you. We're gonna talk about Asset Tracker, IV Pump, and Wheelchair Manager, and also talk about why we've got 3 different ones. When we load assets and pair devices, your physical on-site devices with our asset tags, we can actually choose which apps they show up in. We can have them show up in everything, or we can kind of obfuscate certain assets based on your user roles. And what I mean by that is Asset Tracker, I kind of see as being something that your basic users will be using. Maybe nurse manager, nurses, supply chain, somebody who doesn't really need deep analytics, but just wants to know where something is. This is where they start. Everyone loves a map view. We want to be able to look at a floor plan and see where something is. And if I dive down into a location, I just went quickly down to our first floor, I kind of get a screenshot or a nice little overview of where things are. And I've got them summed up in areas so we don't have this crazy cluster of information. And I can search in here if I'm looking for a specific patient transport bed, or I can also see a breakdown of, hey, what do all these colors mean for me? Okay, monitors are this. Looks like I've got 3 in this area. I can also zoom in to specific spots. Like if I know I'm at the SICU nurse station, I can see, okay, I've got a transport here, a couple heart monitors and wheelchairs in this area. So it gives you that contextual awareness around where you are. And we're able to filter certain different assets as well. So when you log in and you're like, you know what, I only want to see that patient transfer wheelchair, we can filter that so that that's the only thing that you're seeing. So it kind of reduces a little bit of the clutter, so you can kind of pinpoint exactly what you want. And now you can just leave that up on a big board and kind of have it be like your air traffic control for where devices are moving around at a facility. One amazing thing that we've recently done is saving a default location. So we can come in here, choose that, you know what, every time I open the app, regardless of where I am in the facility, I kind of actually just want to know that you tell me information about the SICU nurse station. So I can set that as my location and now know, hey, when I log in, tell me which one of these are nearby. Really fun. So reducing the amount of clicks you just have to make within our application. Map view, fantastic for kind of seeing contextual awareness. But when it comes to finding something, probably not the fastest. Search is always the quickest. So if there's a device that you're looking for or a specific model of devices, just coming up in here, I kind of think of it like shopping. I'm shopping for, I think I've got a Cardinal model in here, yes. A wound vac. So I just searched for Cardinal. I don't see anything up here saying Cardinal, but if I click in here and scroll down, we'll see, that's my manufacturer. So I'm able to search by any attributes I add in here, which these can get quite long. I mean, I've got deployments where there's 20, 25 different attributes, such as next PM date, last PM date, if there's a work order open in another system, a lot of information in here that we can search for. But just by clicking on it, I get a ton of information. I get its current asset status, which is available, driven by what room type it's currently located in. You can see how long it's been there. We've been sitting here for an hour and 43 minutes. And if I don't know where the operating room sterile storage is, I have a map view. I can zoom in, so it'll tell me, okay, we're still the first floor, but it's up here on the top. So very quickly and easily being able to locate the things that I'm looking for with simply a list view. From a drop-down selection, we can create filters for if I'm just looking for a specific asset type. I have subcategories that we call groups. So if the bariatric bed, let's say I want to make this a second floor group. Hey, this is the second floor's bariatric bed. We can now assign that to that specific group. Then I can come in here, filter by my second floor grouping, and find all the related assets that I think should stay there. Also by asset status. I mean, there's a bunch more columns that I don't even have showing up here. But long story short, go shopping for the thing that you're looking for, and you'll be surprised at how fast you can locate things. If I'm looking for my Stryker ICU beds, we don't even need to click into the asset. I can just look over here and see, oh, ERSO utility, cath lab, pharmacy, first floor, just at a glance, see where it's at. So copying your asset ID from your internal systems, pasting it in here, we'll get that information very quickly and easily. From the asset tracker perspective, the summary dashboard will provide us what we kind of talked about at the beginning, which was utilization. All of these exercises are not only about finding things, but figuring out what their journey is throughout a building. And our dashboard will enable you to get insights into over certain time periods. So I've got a little date range for the last 2 days of where have things spent the most amount of time. And our current average utilization is about 44%. So half that time being used and a little more than half as not being used. And this is kind of our breakdown of a lot of time spent in maintenance, a lot of time actually just being ready and available to be used, and a lot of time a very tiny amount of time sitting in areas where it's reserved, whether that means it's ready to be worked on or it's kind of on hold, if you will. And then this will actually give us a current status. Where's everything right now? I've got 28 devices that are available, 35 that are used, 6 that are waiting, and 35 sitting in maintenance waiting to be worked on. A lot of different ways to narrow this information down to facility, floor, maybe we just want to look at specific devices. A lot of flexibility in the reporting because the data is really important. Not only just seeing where things are in real time, but looking back in time to see how it's moved throughout the facility. So that's Asset Tracker, very straightforward app. And now let's move to what I consider a more exciting one, which is IV pump. And let's start you with, I guess we can start here in IV at the summary dashboard. Spoiler alert, we've got it here as well. And same information, but now this is more specific to IV pumps. How are they being utilized? All the different types of IV pumps that we've got. We can break that out, subgroup categories, as I mentioned, and now finding out that, okay, for the last couple of days, a lot of stuff has just been sitting in the clean room. Very little being utilized. This is a fake site. I wouldn't expect 12.5% from this demo data, but 30%, I think 35 is definitely what I'd expect from a pump utilization average over some days. The benefits of the IV pump dashboard is to eliminate your manual rounding. And what I mean by that is having to go from floor to floor, to room and verifying your PAR levels if you're maintaining those. If you're operating from clean and sterile rooms and not keeping equipment actually in the patient room at all times, that's great for making sure that we're not just pushing IV pumps out into every single area in the hopes that we're covering the spot that a patient's going to use it, but having it in a centralized location where nurses can know that they can go and grab equipment when they need it. But maintaining those PAR levels is very difficult because you don't have visibility into what's actually happening in that room. And you need to put on some hiking shoes and wander throughout the facility, floor to floor to floor, especially if you get a large one, and validate your checklist. And we're eliminating that entire workflow of the physical rounding by utilizing our PAR status dashboard. And I've got 3 buckets here for today's setup that'll show me what's critical, areas that are warning, and which rooms have spare devices. If I'm needing get a call, hey, I need a device. Like, okay, where are there spares that I can actually shuffle around? I can click on my spare, and it'll look like the PACU recovery has a spare of 1. Our max is, oh no, it's got a spare of 3. We want to have 4. Oh no, sorry, 1. I'm terrible at math. We want to have at max 4 here, and we've got 5 sitting here, so I've got 1 spare. Great. Primarily though, I love the critical. This is get up in the morning, get your cup of coffee. What needs checked are 3. We've got 3 rooms that have IV pumps that are pretty critical: OR solid utility, the PACU, and the SICU. And we can see right here where we're at from a criticality perspective. So if I zoom this back out to, oh, apologies, click onto critical, OR solid utility, and we'll see here I'm at 5, which I shouldn't be. So we need to go gather and readjust these parameters we'll set in our PAR level settings to say, okay, this specific room type, as we talked about previously, shouldn't have any more than 5 in a soiled room. And if we're at 5 or above, make it a critical alert. If we're at 4 and below, make it a 4 to 1, make it a warning. And if we're at 0, well, okay, well, great. We're optimized. We're operating in a very optimized manner. For a clean room, you know, the inverse. If we should always have 5 on hand. If we're at 5 or below, then this is a critical alert. If we're at 5 or 4 to 1, then that's kind of a warning. We're about close to where we need some. But if we're 5 and above or 6 and above, then that means we've got spares. We don't need them. And it's great to get this live information. I keep talking about the difference between real-time statuses and then historical statuses. So having this information at your fingertips to say, hey, I'm working in this specific location, show me what's currently available here. I can drill down to this area. I can even group by specific rooms throughout the facility. So if I don't care about the type of equipment, I can now go different rooms. So I'll see my, let's find something exciting that we haven't talked about yet. My cath lab, clean storage, my syringe pump. We're currently at 0. Definitely a problem. We need to go replenish this as soon as possible. And being able to manage this, amazing. But what if we want to make changes? How do we make a decision based on our previous record of where things have been spending a lot of time, where I've been over par and where I've been under? If you've been looking at the left-hand column, you've probably been waiting for me to click on PAR level history to show you how we've been performing over time in these certain areas. You can expand your date range to last calendar year, always a great idea. Get as long as possible to see how we're performing. We can narrow this by different groups, whether it's the asset type. So I've got IV pumps, or a specific room, or a location, and then see where we've landed. So greens are, we've been steady. these are the numbers that we set. We've been landing within there for quite a long time. Yellows are your hey, let's take a look at this. So anesthesia, workroom supply. We've been within par for the majority of it, but we have been under for a lot. So maybe we need to consider taking some action here. Do they actually need more or less based on what we're looking at? If we scroll and find some reds, we can see, whoa, our cath lab clean storage. We never have enough. That is an area that we need to remediate. This is an area that folks are using a lot of devices, and we need to make sure that maybe we adjust our parameters to say, okay, don't send me an alert, or don't call this par status out because we're at 5. Maybe we need to raise that threshold to 10, or vice versa. So allows for looking back over time and deriving some insights from where your devices have spent time. Map view operates the exact same way that we saw in asset tracker, so I won't go through that. The list view, same theory here. Search for something if you're looking for something very specifically. The inventory table is where we can derive insights really quickly from a live perspective on what statuses devices are. And we change a device's status based on the rules we set up with you on what room a device is, or sorry, what room type a device is in the facility. And we can say, okay, if you are in this type of room, we'll mark you as available. If you are in this type of room, we mark you at down. So down, I think we've got configured, supply rooms, storage rooms. We're unsure of the status, really. So able to search this list, filter it as we want, just kind of see at a glance what our inventory is and where things are sitting. Now, if there's anything in our par level status, history, inventory table, list view that you think we're not providing for you, lucky you, we have an integration with an AI, a useful little fun bubble at the top, no name right now, open to suggestions. And what it does is allows you to just ask a question in plain language, like show me room names with clean IV pumps right now, and it'll give you a response. So if you don't want to go and look at the dashboards, just come in here, have a conversation, and see, okay, these are the ones that have clean IV pumps. Great. Allows for really great user interaction. And I like this as well because if there's a report on the summary dashboard that's not available, and you talk to our customer success team and they're like, yeah, we'll get that turned around and get that added. You don't even need to wait for them. Just come to Ask AI, ask the question, and get a response in real time on your data. Beyond that, I really like, we talked about button presses earlier to kind of shorten the amount of time it takes to get notifications about certain things. And I like using the alert rules engine to automate workflows for you. So for instance, for the button click, I can come in here and say, hey, let's name this, let's call it device broken for now. And I'll say it'll apply to, I actually only really care about, I want it to be just specific for these IV, for just our general IV pumps. We'll do all locations. Okay, let's do the medical center. And let's do red button because we can do blue button for something else. And then I have all these actions to say, okay, great. When somebody presses the red button, send me a notification in ServiceNow or some other system. We can configure that with our webhooks capability right here. Or just shoot me a text message, shoot me an email so that we know. A lot of different ways we can do this. Blue could mean a host of things. Red can mean a host of things. A lot of flexibility in how we make these rule changes. Another one that you saw here is par level alerts. We can select specific rooms to say, hey, when it actually moves out of par, send me an alert. Instead of having to come into the application and look at something, shoot me a text, hit me on Teams, on WebEx, on Slack. Really just bug me to death until I actually come out and check this. All up to you, of course. Another fantastic one is location alerts. And this is how, you remember back we talked about telepacks, 4% of a 200 bed hospital on average, their shrinkage is 4% on telepacks. We get a location alerts now for when a device has left the building, and we can apply it to, let's just select everything and say, hey, it's actually left the medical center, the General Memorial Hospital. Do these actions, announce in here in my alerts tab, make a noise, send me a text, Slack message, all the other things I mentioned previously. The alert rule creation for location alerts is going to help stop things from leaving the building and never coming back. You can also use that in an even more granular way to say, okay, if this device actually enters the loading bay, let me know as well, because might be an actual decent indication that it's in the trash and we need to go and retrieve that. Or it's entered our laundry room. Let's make sure we're incineration room. We don't want equipment there. Let's make sure that when they enter these specific locations, we're getting alerts to proactively let us know that expensive pieces of equipment are about to be gone forever. A lot of different ways to break out alert rules. Now, I kind of breezed over it at the beginning, and we'll come over here and just talk wheelchair manager. We have a separate application for wheelchair manager because we're seeing more and more just different teams that are responsible for simply transport stuff, beds, stretchers, wheelchairs, and also have very similar issues like IV pumps in maintaining a par for certain floors. And having the capability to transport patients out of the facility has a really big impact on your bottom dollar, because if we're waiting a long time as a patient to get out of the facility just because we're waiting on a wheelchair, very good chance somebody's in the emergency department or another department is actually waiting for that bed but can't because we can't find a wheelchair. So now we can maintain with the same level of statuses that I was showing from the IV pump manager perspective, where we need to look and make sure that we've got some, hey, does the front entryway have enough? Does the ED have enough? Does our second floor, certain specific departments, are they covered? Do they have the 4 that we should have there at all times? And also, have they left the building? Let's make sure to go, we know we've got 10 that just walked out because I have an alert, go gather them up because they haven't returned. Which is another problem. Shrinkage on wheelchairs. They're the nice ones. People like the ones the hospital has. Maybe they like it too much. So now we can get those alerts to help you actually retrieve your wheelchairs when they do leave the building. The par level history operates the same way. Map view, list view. The app itself, when we're a user, we do a lot of this configuration via Active Directory and single sign-on. So depending on your role groups, you could log in and simply only see Asset Tracker. You won't see anything else on my screen. You'll just see Asset Tracker, just focused on what you need to work on. Part of the transport team, you'll only see Wheelchair Manager. Clinical engineering, biomed, I see usually having most of the apps, most of the time spent in IV pump or in Asset Tracker. That's been the live demo. There's a lot more I could cover as far as how to set up different groupings. One other really important thing that I'd like to show is when we are providing the room type status, we're able to know based on our location technology if something's in a patient room or in a corridor. And a lot of times I need something fast. I don't want to go to a computer and log in. So the next level of responsiveness for the health system is what we call the Kio Nurse Assistant mobile app. And as you can see on the screen from your mobile app, you're the little green dot and you can see unavailable or in use devices near you. Okay, these are all IV pumps, they're red. I can't go grab those, but there's one in the hallway that I know is available. So now I can actually get directions down to where I need to go. Fantastic for new joiners to your company, new colleagues who aren't actually familiar yet with the layout of the facility, now getting directions to where they need to go. You'll be able to search, or you are able to search for assets, filter by different types. But my favorite feature of this is just the awareness nearby of, oh, I need an IV pump. I just pull out my phone. Okay, there's one just down the hallway, a few feet from me. Let me go grab that. Super, super beneficial. So what's the impact on your health system? You'll see here on the left, I'm not going to go into the ROI exercise too much. If you scan the QR code on the right, we have a whole calculator on our website. So if you're curious, it'll ask you a couple questions about your facility, like how many beds, how many devices you have, how many employees, and then it'll send you the results of this is what we estimate from an ROI perspective if you're implementing a Contact IO platform solution. But out of all the different use cases, asset management has the biggest impact on expenditure. A lot of devices that are being underutilized, that just having to spend a lot of time looking for, and streamlining this approach is extremely beneficial. So ROI calculator from the QR code is on our website. How to deliver, or how we deliver. We treat this as a turnkey installation where we come out, we'll spend about 4 minutes in each patient room installing any room sensors we need to augment the location services perspective. We'll also tag any assets we see. We get a huge percentage of all assets tagged because we're already walking around the facility installing things, and while we're there, we might as well be hitting your assets as well. It doesn't need to be a separate project. We have a less than 30-day install schedule. Our 200-bed facility install average is 10 days, really, really fast to be able to deploy to a soft launch. And this includes everything, tagging all the assets, our end-to-end delivery, setting up the cloud, which is very minimal, truth be told. And it's a managed service. We're keeping track of performance, battery levels, and then allowing users to be added to the system and scale without additional stress on IT. So we set up that single sign-on, Active Directory stuff, and away you go. The assignment from tags to devices, we've been thousands and thousands and thousands and thousands of tags deployed, so we have a really good idea of which one of these little guys work best for different form factors. As I showed earlier, sticker tags go to phones and laptops. Usually we're doing the asset tag mini to pumps, this gentleman to wheelchairs and transport equipment. We'll install any infrastructure as needed. No on-site servers, and I think the most important piece about this is to reiterate is that we're up and running in 2 weeks. No reason to wait for a 6-month project plan or a year to run cabling, things that are really a thing of the past. This is a fast and easy deployment and an easy way to unlock visibility into not only where your equipment is, but what it's been doing. And one of the most important things, do I really need all this? So with all that being said, I think we haven't really been keeping track of the question section. So hopefully we've got some good questions in here. Let's kind of knock out those, if there are any, John.
Thanks, Tim. Great job. We did have one question come in already. Looks like a couple of more are getting ready to come in. So what are the common KPIs for an RTLS system in a healthcare setting?
Yeah, typically from an API integration perspective, doing a lot of stuff with CMMS and your existing systems of record to pull in that whole section I showed about attributes to make sure that there's parity between them in regards to this is the manufacturer, this is the model, this is the serial number. Because one major issue in the past is that there's so many siloed data systems and no one was really sharing their information very effectively. So we operate off of we've got tons of webhooks, but also RESTful APIs. That standard is what we use to communicate with other systems to receive and to send information.
Right, right. And then you touched on this during your presentation, but how does AI factor into healthcare and RTLS systems?
Yeah, great question, and kind of one of the more exciting ones. Um, One is the Ask AI feature that I showed, where we're using artificial intelligence to kind of understand what's the question that's being answered, and then making sense of the data set, and then giving you an answer that makes sense for a human. Another, I think, really more exciting piece is when we are deploying or when you're tackling what we call the three pillars of a responsive health system: medical equipment, patients, and staff. It's generating a huge amount of data, and that's a lot of information about what's happening operationally within the facility. And we can use AI to derive insights from that data to say, or to tell us, what's the impact of the amount of equipment in this department when there are this many patients and when there are this many staff who are doing these certain types of tasks in this specific area. So by unlocking kind of each one of those pillars, you're unlocking the capability for using artificial intelligence and machine learning to figure out better ways to operate, and do more predictive analysis.
Okay. Another question that we had come in is if an area is remodeled or rooms change, how easy or hard is it to rename, create new locations?
One of my favorite questions, especially because the answer is it's very easy. I mean, you saw smart location, which is what we use to kind of lay out, and I keep saying it, but carve up your interior. Very easy to upload a new image. I mean, there's literally a button called upload new image, and you'll just click and drag some of the little blocks around, rename them, and away you go. Previous systems that I've seen, that would be a project, a paid expense, a 1-month project. It's maybe 30 minutes for your customer success manager to do it. Very easy. The hospitals change constantly, so we know that because we've been in this business for a while. Things are shuffling around. One room's now two rooms now one. This is no longer a storage room, it's now a patient room. And we need to be adaptable and be responsive as well.
And then this question, not sure if I'm reading it correctly. How confident are hospital managers, or how confident do they feel with sensitive asset information stored on the cloud and managed by third parties?
Yep. I'll say extremely confident. Part of my role here is filling out very long and tedious and detailed security questionnaires, and I've passed all of them with flying colors. The information we're storing, we're tons of information on the website regarding our security credentials, but I think the most important being we're SOC 2 Type 2 compliant. With medical equipment, HIPAA doesn't really come into play, but we are also HIPAA compliant. So from a data security perspective, people love us for that.
Then I think we have time for one more question, and then we'll email you the ones we didn't get to so you can reply.
Okay.
What is the accuracy percentage for specific equipment asset tracking? I guess they're asking how accurate are the tags or the location.
Yeah. I like to say the easiest way to explain it is I'm room level accurate 100% of the time. So if a device is in a room, I know it's in that room and not the room next door. If it's in the corridor, I know it's in the corridor and not the room next door. With our location services, I'm always the right floor, always the right room. So very accurate, because having high accuracy is really important for maintaining par levels, because you clean and soiled rooms are usually right next to each other. So if I'm off by a little bit, the data I'm giving you is worthless. So we know which room you are in.
Fantastic. And we'll email you those questions we didn't get to so you can reply to them. Thank you so much, Tim, for your time today and a great presentation. I'd like to encourage everyone to visit the Contact.io website to get more information. As promised, the answer to today's trivia question is, drum roll, Paris, France. So congratulations to our winner, Annie Notman at Crothall in North Carolina. A quick reminder that you can obtain your CE certificate by completing the post-webinar survey. The survey will be emailed in 1 hour. You must complete the survey to receive your 1 CE credit from the ACI, and you will be able to download that certificate directly from your computer once the survey is submitted. If you have any questions or have any issues, you can reach out to us at webinar@mdpublishing.com. Just shoot us an email. We will be back next month with another Tools of the Trade Live demo and another great prize as we continue to celebrate our 10th anniversary. Visit webinarwednesday.live for more details, a complete schedule of all upcoming webinars with free registration. And don't forget to nominate a colleague or yourself for a Tech Choice Award. Just visit onetechnation.com and click on the trophy. Thank you again, Tim, and everyone have a great day.
Bye, everyone.